Hi, Dr. Reynolds.
Hi, Amanda.
How are you?
I'm fine. How are you?
I'm good. Welcome to Urgent Care Management Monthly.
Thank you.
Well, apparently today we are going to be discussing the compensation model for providers.
Good.
And if you would you please tell us why it's a good idea to have the compensation model?
They like to get paid, as it turns out.
Yeah, that'd be nice.
As it turns out, in the end, they do like to get paid, but everybody likes to feel like they've been paid fairly for what they're doing. And that's really what this kind of conversation is about, is how do we take doctors, PAs, and nurse practitioners, and at the end of the day, they feel like they've been compensated fairly for the work that they're doing, and we feel like we're getting from them what we should for the compensation we're giving them.
So do you have more than one compensation model depending on what they're looking for?
Yeah, I'm actually giving the talk on this very subject at the UCAOA conference in May in Chicago, and I'm giving two of them actually, and it's funny because my first slide, I don't want to give it away, but my first slide essentially says if you've seen one physician compensation model, you've seen one physician compensation model, because there's 1,000 ways to do it.
Mm-hmm.
And different physician groups do it differently, depending on the size of the group, depending on who's in the group, depending on the philosophy of the group. And so, yeah, we have the model that we used last year, we have the model that we're using this year, and we have the model we're going to use next year.
True.
Right. So it changes over time. It changes based on the philosophy of the group. And so there's basically about 4 or 5 different basic models you can use.
And which one do you use?
Well, we've changed that over time. The most basic model is basically just trading time for dollars.
Mm-hmm.
So where you pay them pay somebody by the hour, or they may be on salary, but basically whenever they put in a certain amount of time, they get a certain amount of money. That's the most basic. It's probably the most common, and it's the easiest to manage, certainly, because the provider knows at the first of the month, I know what I'm going to get paid at the end of the month, because I can figure out how many hours I'm going to work, and I know exactly what my paycheck's going to look like. So that's easy. It's easy for the chief financial officer, or the person doing payroll. They add up the hours, and that's what they pay. So it's certainly the least complicated. All of the models, by the way, come with positives and negatives. Okay, that's the good news. The bad news about it is your best highly motivated people don't like it, because they feel like they're doing more work for the same amount of pay as the people doing less work for the same amount of pay. So they don't necessarily like it, and it doesn't really reward people for good behavior or some of the other things that you might think are important.
So with the compensation packages, I assume you're including 401k, insurance, vacation time, and things of that nature.
Yeah,
or do you just throw in a bonus pool as well, or how do you?
Kind of a combination of those things. Certainly at our clinic, in our company, we do that. We provide a full compensation package, and we have all benefits, including 401k, health insurance, dental insurance, malpractice paid, CME, vacation, those kinds of things. But every practice that I've been involved in, the companies that I've owned, it's been different depending on if the doctors were independent contractors, if they're employees, and what the company was able to tolerate at that time. So you sort of got to look at your resources, say how big is the pool of money that we can spend, and then how do we want to divide that pool up. And so the other end of the spectrum, other than being paid for time, the other end of the spectrum is you're paid purely on productivity. In other words, you eat what you kill, right? So however much money you bring in, net revenue, or RVUs, or how many patients per hour you see, some sort of mechanism whereby you're paid for your productivity. That's the other end of the spectrum. Advantages are suddenly patients are good people, right? You want as many of them as you can get. And the other thing is your high performance providers are happy because they get paid more. The negative side is it's a little more difficult to control. You have to do some more calculations to do it. And you can get a highly competitive environment which may not become friendly. You get chart picking where people say, hey, I'm going to take that laceration because it pays more than that nosebleed. And so people can start picking charts, and you can create somewhat of a competitive environment. Like I said, they all have advantages and disadvantages.
So would you recommend doing a combination of the two, where you pay them hourly and then you do a bonus pool based on their productivity?
Yeah, that's the way I think, certainly the way we've done it sometimes. I think it's the way we're headed now. And it's probably, having done the research for the talk that I'm giving and for this talk and for the article, I certainly think we're even going to reevaluate the way we're doing ours now. What I think maybe is the best for us, and it depends on the philosophy of your group. What you need to do is look at all the compensation models. So the third model that we're now talking about is some sort of base, and then on top of that base, some sort of amount of money that's at risk. So the amount of money they can either not get because they didn't do certain performances, or get extra because they did other things. And it's once again the disadvantage, a little harder to manage, because now if you're the CFO or the person up there, there's a whole bunch of things to look at, or me, there's a whole bunch of different things we have to look at to decide. So it's a little harder to manage. And to be honest, it's the hardest to put together, because it takes a lot of brain power. You got to sit and think, okay, what are the things that are important to us that people get paid for? And the things that are important to us may not be the same things that are important to you, the audience. You have to sit down with your group and say, okay, what's important to us? Is seniority important to us? Is working the shifts other people don't want to work important to us? Is customer, patient complaints important to us? Is patient care important to us? Is energy? What about administrative time? So there's many things that you can figure into the equation, and then put your own sort of flavor that fits your group and say, well, how are we going to compensate our other physicians?
Well, one more question before we wrap it up. For your physicians and then your physician extenders, are you going to put the same model into place with both as far as the patients and per hour stuff? Because I know that the physicians there are mostly there to oversee the extenders, so they don't get to see as many patients as the extenders do. So how would you compensate for that?
Right, our model is a little bit unique in that way. Our model is unique in that we have our physicians are overseeing extenders to quite some length, and so you have one physician maybe working with 3 or 4 PAs, nurse practitioners. So it really wouldn't be fair to penalize the physician because he's seeing less patients. If you did that, you're going to create a competitive environment that we don't want. So in our model, certainly we have to take that into account. In another model where you only have physicians, or another model where that's not the case, it may not have to. So in our model, we're going to have to take into account teaching, because our physicians do teaching, and supervising PAs and nurse practitioners, because they do that, and see, as we put ours together. And then we have one now that works pretty well, but as we look at it we're a 5-year-old company. Here's the question. When we're a 10-year-old company or a 15-year-old company, and the doctor's been with us for 10 or 15 years, does that have meaning, or does he make the same as the guy who started yesterday? That's a decision each group's going to have to make for themselves. That's what I meant by seniority. So over time, some of the things that you may do differently when you first start your urgent care center today, everything may seem like it works. That's why I say there's a model we used last year, this year, and next year. Over time, as you grow, as you get bigger, as you get more physicians, more physician extenders, and things and circumstances change, you can change your compensation model to meet your philosophy. So I really think the best thing is to take all of the models, kind of look at each thing, and then sit down with your group and get buy-in from everybody and say, hey, what do we think is important to be compensated for? What do we think is important to be penalized for? And put together a model that works for everyone.
Well, that is a very good tidbit of information.
Thank you
so much for